Hello, welcome to episode 24 of today's podcast. We are here with Sapna Mehta-Gertz, Doctor of Audiology at Weill Cornell Medical Center in New York City. Welcome, Sapna. So glad to have you here. Sapna was a previous adjunct professor at the City University of New York, and I'm so happy to feature her today because we're going to talk about tinnitus retraining therapy success stories. I'll pass it now to you, Dr. Mehta-Gertz. Please go ahead, introduce yourself, tell us what you do in our audiology community, and then get right into these success stories with TRT.
Right. Thank you, Ben. And thanks for having me on. It's a pleasure to be able to speak about tinnitus. So my name is Sapna. You can just call me Sapna. I been working as an audiologist for about 6 years. As Ben mentioned, I worked at a medical center. And so I do see a lot of variety of patients. One of my passions is seeing and helping patients manage their tinnitus. And so in about 2017, me and a colleague of mine at that time helped start to develop kind of a tinnitus program where we tried to have more structure into how we approach patients who come to us with tinnitus, rather than kind of having too much of a scattered program where you get different answers from different people. So I think is often a very typical experience for a lot of patients. I can jump right into some success stories. Definitely have quite a few of those. I think you kind of think about this as well and talk about this a lot as well. But I think tinnitus is something that can very successfully be managed. I think there's a lot of negative thoughts and stigma around tinnitus, that there's nothing that can be done about it, that, you just kind of have to live with it. I know a lot of people do say that, and a lot of patients hear that, unfortunately, but I think we probably both agree that there's actually a lot that can be done.
Absolutely. We'd love to hear your success stories whenever you're ready.
Okay, so I'll tell you one example of a case that I have is a patient who did do tinnitus retraining therapy with me. She had tinnitus for about 8 years before I had seen her, and it wasn't bothersome for the full 8 years, but about 4 or 5 years prior to her coming in, it did start to become louder, more bothersome, and she started to have sound tolerance issues where she eventually avoided going out to like the grocery store, just even going outside social gatherings, because it was very bothersome to her and distressing and could make her tinnitus louder. So she came into us and we found that she had a unilateral hearing loss in one ear, and she had been treated with a hearing aid previously to this, but she'd never really worn it because she found it uncomfortable, probably because of her sound tolerance issues. And so we started to work with her doing tinnitus retraining therapy, which involves sound therapy as part of it, and counseling as a major part of it, educational counseling, and also a little bit of kind of cognitive restructuring counseling, where we really try to help patients frame their tinnitus in a different way and frame their approach to how they're thinking about any kind of treatment for tinnitus in a different way. And I won't get into the numbers too much, but one of the first things we do is assess the tinnitus with some kind of objective tools we have. So one is a kind of a handicap inventory, which just gives us a kind of baseline of what the tinnitus severity is in terms of how the tinnitus impacts the person's emotions and behaviors. And hers was a severe degree. It was a 72 out of 100 score. And so from there, we, started to fit her with her own hearing aid. We refitted, actually, just completely reduced the amplification so it wasn't bothering her as much, and gave her a sound masker, because sound masking, I think, and I think a lot of people probably do feel this way, because it's one of the most common treatments for tinnitus. It can really give a person control over their tinnitus in the moment, which I think that the ability to have that control, even though we know that the sound therapy probably will not forever and ever stop the tinnitus, cure the tinnitus, take it away, I think giving that sense of control to somebody really helps kind of train their brain into thinking that this is not as dire an issue. It starts getting you in that mode that you do have some control over it. There are things that we can do to reduce it, which is very helpful. And so she started to use the masking therapy for some time. We started her kind of on a regimen with the therapy and increasing the loudness of that sound masker to help reduce her hyperacusis, her distress with loud sounds.
Let me ask you a quick question. And you said they've had tinnitus for 8 years. Was there a period of time where it spiked or became bothersome, got out of control, and is that when they sought help?
So yeah, that was about 4 or 5 years before she saw me. It had gotten louder. So she had seen somebody prior to coming to our center. She had seen an ENT because she did have some other medical issues. She had dizziness, a hearing loss at that time. So those medical issues definitely had to be addressed, and they were initially. And that's when she was initially fit with the hearing aid about 4 or 5 years ago. When she came to see us, she was still, she didn't have a particular spike in her tinnitus. She was just still looking for a solution,
It was a chronic case, and it was progressive, and it was constant, and
yeah,
it was on her mind, and she wanted to get an expert help opinion.
Yeah, she just, I think that's pretty typical. Like sometimes people will kind of just look, they're looking for an answer, and it can take a while to find somebody who is, I want to say, I don't want to say willing to help them, because I think all healthcare providers are willing to help the patient, but it definitely is a kind of a niche where there's not a lot of medical treatment for tinnitus, because most tinnitus cases don't have a medical pathologic basis to it. There are, of course, some, and they definitely need to be medically treated, but most cases are idiopathic or related to hearing loss, or even if it's like very slight hearing loss. And so it's a tricky thing to find help for sometimes.
Yeah, definitely. So bring us back. You're working with this patient. You diagnosed tinnitus, unilateral hearing loss, and hyperacusis sound sensitivity. So how do you approach the expectations, the timeline, and the technology?
So for the expectations for tinnitus retraining therapy, generally, I will set the expectation that it's going to be about a year to 18 months. And I do tell patients that I do think that's kind of an overshoot. I think most people probably will notice benefits long before that. And that, I mean, in clinical practice, that's what I've seen, it's really true that it doesn't usually take that long, but I think, realistically it could. And I think having that time scale can be helpful in, not making patients worry when they don't think that they are where they should be potentially. So we set a year as a timeline. She had her own hearing aid, but we adjusted the hearing aid right away. She had it with her. So she was like, that was ready to go, which is nice. Sometimes it could take a couple of weeks to get that started. We set her hearing aid, like I said, for minimal amplification, basically nothing. And we put the tinnitus masker in. When I set a tinnitus masker, I'll try to find a comfortable level, and I'll do some measurements with the tinnitus masker to make sure that we're not too loud, because she had a pretty severe hearing loss. So this is going to be a noise she's going to be having in her ear constantly. You don't want it to be damaging to her ear further. So you have to make sure that it wasn't putting out too much, but also still be audible to her. And so we started with that. Then every couple of months, I would follow up with her, do counseling with her, in terms, following up, of course, how she's doing. And honestly, she very quickly adapted to her loudness tolerance increased very, very quickly, which I think is typical. And her tinnitus distress decreased really quickly too, actually a lot faster than I expected. I have here my notes here, within a month, she had reduced the amount of time she was hearing her tinnitus. So she was hearing, it was very bothersome to her about 25% of the time when she first came in to see me. And that's primarily, when she would call it bothersome when she would feel irritated with her family members, get very, very anxious about it, but it was always present to her. She wasn't able to sleep well. After about a month, she was sleeping. She didn't have any troubles with sleep anymore. And then after 3 months, her tinnitus handicap score dropped from a 72 to a 10. And a 10 is basically a slight to no handicap from her tinnitus, which was really amazing. I did follow up.
Say that again so everyone can hear that a second time, please.
Yes, her tinnitus handicap score dropped from a 72 to a 10 within about 3 to 4 months. She was able to sleep well. Her tinnitus did not go away completely, but she was managing it as if it wasn't bothering her, as if it was just another sound in her environment, which is really where we wanted her to get to.
I want to celebrate that. Great job. And great job to the patient and their brain and their work. Obviously, it was not a completely passive process. They put effort into it.
Definitely.
Earlier, you had stressed the importance of setting long-term expectations, that this may take a year and a half, 12 to 18 months before your tinnitus feels significantly different. That said, we often see patients 6 months, they're feeling a lot better. Yeah. So I want to make sure that everyone who's listening in the community here gets that message, because it's so important not to give up. If there's no medical cure, if there's no medical procedure or medication that's going to dramatically change things, then we have to take the long path. And it might not be easy. It might be hard, in fact, but it's worth it. It's worth it. And what you shared is important for us to hear. So what was the resolve with this patient after 3 or 4 months? How often did you have touch points, and what did they report back to you?
So after the 3 to 4 month, I did see her at the 6 month mark, just as part of our kind of standard protocol, just to check in on her device, make sure everything was working. And I mean, I usually often try to do some tinnitus assessment measurements during the therapy. And we actually weren't even able to do it because every time we put her into the booth, she wasn't hearing her tinnitus while we were in the therapy session, which was really great. I mean, we didn't get our measurements, but obviously for her, she had times where she wasn't even hearing it.
And that's in a quiet room when there's no other sound.
In a soundproof, sound treated room. Yeah.
Well, that message is something that I've shared on a different video with a different patient on a podcast episode. And the responses, the comments were lighting up, because that message is not what people find when they search tinnitus on the internet.
Right. Yeah.
And a big question that honestly, I have not had the long-term care of a patient who's had chronic tinnitus for years and years and years, and who's come to me and we've dramatically changed things. So to hear this from you now is, and this is a question that I get, okay, that's amazing, Ben, how this patient has had tinnitus for 6 months, 1 year, 2 years, and it got better. But what about me? I've had it for 4 years. I've had it for 8 years. I've had it for 20 years. Mm-hmm. And what you're saying is this patient had it for, 8 years? 8 years, yeah. Yeah. So another important point to share to anyone who's listening to each of these podcasts closely is that you're adding a very valuable piece that we haven't touched on so far in these podcast series. That's great. Is there anything else you want to add on this case study before you switch to another one you may have prepared?
No, I mean, I've spoken to her, which is, of course, with the pandemic, a lot of things did fall off, but I actually did see her last year. Even with the pandemic, the high stress, she was in one of those high stress, hard hit areas in the beginning of kind of all of this. And even with that, she was able to manage her tinnitus. I mean, we know that stress can often spike up tinnitus again or cause a new distress, but she was managing very well. So I think that's probably, good to know that, because I think a lot of people have that worry too, that what if my tinnitus gets re-triggered, or what if I get a new sound or something like that. And I think it's important to be realistic. Like, it's possible that can happen, but the therapy isn't treating your tinnitus sound, right? It's treating your brain's ability to reorganize and deal with it. And that's a skill that you learn and that you'll be able to use going forward.
I love that. And what is your opinion on what's the breakdown between, is this a psychological value we're giving, or is this a technology value we're giving? Or if it's somewhere in the middle, what's the breakdown? Because most of audiologists are recommending technology. Some of audiologists are performing counseling techniques that are aimed at the limbic system of tinnitus. What is your opinion? What was your role in that success story? Technology plus counseling, or one or the other?
I think that's a good question. I think as an audiologist, our role should always be to bring the two together. I think, hearing certainly is a peripheral issue that can partly be treated with technology. Amplifying sounds or generating sounds to the ear is definitely one part of it. But, you're always dealing with the whole person, and everything, hearing and tinnitus, all of that happens in the brain. The brain is extremely, extremely complex. And even psychology, like psychological behaviors and emotions and things like that, they do also have a physiologic basis to them. So I think if we think of it that way, and I try to educate patients this way too, that they themselves also have a role in combining the technology piece, whether it's with an on-ear device or an app that has some noise that they like, or even a behavior, maybe not a technology, but doing some like exercise, even just exercise, cardiovascular exercise, so anything to help reduce their stress levels. And that's where I think for tinnitus, that's where I think the technology does come in. It helps reduce it gives you kind of a break from the constant onslaught sometimes of the tinnitus, and that allows you to focus on the psychological part, which is the relaxation, stress reduction, and really reframing the way you're thinking about the tinnitus. And sometimes you can't do that in certain stages if it really is so bothersome, right? If your anxiety is so up because of a stimulus, it's very hard and that's our nature. That's the way it's supposed to be. When we're very anxious, our brains are not supposed to be focusing on anything except the thing that's making us anxious. That's our survival response. And so, taking a break for that is needed to retrain yourself.
Yeah, thank you so much, Sapna. Love that. We have about 5 more minutes here on today's podcast episode. So I would love to have you back for another conversation at a later time where you can have more success stories, and maybe there'll be new success stories that patients you haven't even seen yet. But I would now give you an opportunity, if you'd like to have more of a sort of rapid fire case study within 5 minutes. Did you prepare another case study you'd like to share?
Yeah, sure. I can quickly go through another one. It's a similar type of story where it's TRT rather. So not a similar history, but we're using TRT here. So same thing with the technology. Patient came in with a sudden onset of tinnitus, kind of out of the blue, doesn't know where it came from. And she came in a very acute state. So this is not someone who had it for years and years. She was all of a sudden had it, and she came within the first month of having it, and she couldn't sleep. She lost 20 pounds, like very, very distressed. Also very severe score on the tinnitus handicap. Her progress was different than the first patient that I discussed. So we fit her with hearing aids after a couple of weeks. But the first time I saw her, we did a lot of intensive counseling and really went into very deep detail about as you were mentioning, the limbic system and its important role in her reaction to the tinnitus. And her husband was with her. He's an engineer, and he was very interested in kind of learning more about this. So I told him to read the Tinnitus Retraining Therapy handbook by Dr. Jastroboff, and he read it cover to cover. So he ended up being a very good support for this patient during her therapy, because he kind of learned all the principles that I was also using to counsel. So with the sound therapy, she kind of had a so-so reaction to it. She didn't love having the sound in her ear, but did find that it helped reduce her tinnitus. And so she was a little intermittent with her usage of it. And we did have to adjust it quite a few times. So that was a bit rocky, but she was getting benefit from it. When I saw her 1 month later, before we even fit the hearing aids, her handicap score dropped by 20 points, which is significant. And that was just from the counseling alone, just the knowledge that there's some plan in place, that there's a reason for this happening. Over the next, 5 to 6 months, she had kind of ups and downs where her tinnitus did get it changed pitch. She had a medical treatment that seemed to make it worse for some time, but she was always able to come back down. And I'll just kind of briefly jump ahead. Where we ended with her essentially was that she was able to eventually sleep with her windows closed, fan turned off, no masking noise on. She didn't stop hearing her tinnitus. She was still hearing it. And she did have periods where she was like, I want to find a solution to get rid of it. But she definitely was able to manage her health and her well-being better around her tinnitus. So I think it's still, still a little bit of a work in progress, because she's still looking for a solution to eliminate her tinnitus. I think her husband is there to support her to kind of reframe her way of thinking, that we're not trying to take away the sound, and that she already has been very successful in reducing her tinnitus. But I think that can often happen. I don't know if you've seen that, where sometimes the measure of what's a success story can be different for different people.
Very much so. And it sounds that you met this patient in what we have coined here the urgent care phase, where high anxiety, insomnia, panic states, and it's a tough place to be in. And we are there to help that person. And oftentimes that's a team approach. So getting someone through that urgent care phase as quickly and pain-free, as easy as possible, that's a big part of it. And then the timeline for that case was how many months after or so did you follow them?
That was about 5-6 months afterwards. She lived out of state, so that was also a bit of a hurdle for her coming in and out. We followed on the telephone quite a bit. And so during the pandemic, I followed up with her to see if we could do anything remotely, if she needed any follow-up. She actually said she was okay postponing, because she felt comfortable with where she was at. So far, it's been good. I'm still to follow up with her to kind of see where she's left off now.
Great. And that message is so important for those who may have developed sudden onset loud obtrusive tinnitus with anxiety, insomnia, and panic tendencies. In those first few months after that, it's really tough. We know, you and I, Sapna, we help people through that. It's not easy. And if I had to go through that, it would not be easy for me. Right. But there are tools that work for most people. And if someone's case history is like most people, then it probably will work for them too. I really thank you for joining us. And I know those listening will get a lot of value when we can learn through others' successes others experiences, it makes it much easier and relatable. Tinnitus can be an invisible and an isolating condition. So anytime we get these stories out there, it's a great thing. I want to pass it to you. Where can someone find you if they wanted to work with you? And do you have any last messages or projects you're working on for the tinnitus community?
Well, thank you for having me, Ben. I want to say also, patients can find me at Weill Cornell Medical Center and New York Presbyterian Hospital in Manhattan. I do provide teletherapy for patients in New York State. So that's another option for people who are not able to travel in. And in terms of projects I'm working on, I'm not particularly working on any tinnitus research projects, but definitely am looking into expanding teletherapy services. I think that's probably one of the most beneficial ways to reach out to patients.
Thank you so much. This has been episode 24. Tune in for the next episodes. And Sapna, hope to have you on again sometime.
Thank you, Ben.